Anyways, in this situation, a student gave the patient an oral liquid dose of vancomycin by the IV route. Oh my God, like that's bad. That's bad. Welcome to Nursing with Professor B. My name is Bridget. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I'll be going over examples of student nurse medication errors that occurred. The purpose of this video is not to shame the people that made these errors. The purpose of these videos is for you to learn from them so that you do not make these mistakes yourself. Following are some real life examples that occurred to nursing students. Held or discontinued medications. Students have not known or understood the organization's process for holding and discontinuing medications and have administered drugs that have been placed on hold or discontinued. Sometimes they will do this with the Lovenoxes, the heparin. If let's say the patient is on heparin and their APTT is way too high and they need to hold heparin, a lot of times on the MAR will be grayed out. But again, if you're a student and you're not familiar with this, that's why with medication administration at the facility where I work, students are only allowed to pass medications with their instructor there with them. I do not allow students to pass medication with nurses because again, we don't want these situations occurring. So a student gave a dose of Lovenox that was noted to be held on the MAR. And then another situation, a student did not know the meaning of a yellowed out section on the MAR and gave the patient an IV dose of potassium chloride that had been discontinued. So God forbid this patient was hyperkalemic and you give them some potassium, you could put them into cardiac arrest. The organization should review its procedures for holding medications and make any necessary revisions to ensure that the procedure is clear and reliable. Share the organization's procedures for holding and discontinuing medications with nursing instructors and students. This is why I have a master's degree in nursing education. I went back to school to become a family nurse practitioner. Do you see the liability that goes on when you're an instructor? Like the amount of mental gymnastics you have to do to keep tab of all your students and make sure that they are providing safe patient care. And this is why I do not think it's right that nurse educators are paid so little money. One of the reasons why I decided to become an NP, it's not the only reason, there were many other reasons, but one of the reasons was that nurse educators are very underpaid. So it's not right. Nurse educators should get paid a lot more. Monitoring issues. Students may not be aware that vital signs and or lab values should be checked before administering certain medications. A student gave a patient with an INR of 2.33 a dose of Lovenox, which was noted to be discontinued on the MAR when the INR reached 2. The patient was also on warfarin, yikes, which is another blood thinner. A student administered a dose of Epigen to a patient with a hemoglobin of 15.5. The dose was listed on the MAR to be held if the patient's hemoglobin exceeded 12. So Epigen stimulates the production of RBCs. This patient had already reached the level he needed to be at. So this patient had enough RBCs now, and now you give them some Epigen and God, I hope they don't throw a clot or something. Be sure students and nursing instructors know how to access the most recent lab results and are able to obtain them. Work with students to help them identify vital signs and lab data that may alter medication therapy. A non-specific dose that was dispensed. Student nurses have administered excessive doses when they expected the drug to be provided in a patient-specific dose, but pharmacy had dispensed a larger dose or quantity. So for example, Ativan, which is a benzodiazepine, will sometimes come in a larger quantity than is actually administered. And if you give your patient the whole vial of Ativan, they could potentially go into respiratory arrest because you've over-sedated them. Student nurses have administered excessive doses when they expected the drug to be provided in a patient-specific dose, but pharmacy had dispensed a larger dose or quantity. You always want to check the order. What is the dose that is ordered and how is the medication supplied? That's why they make you do all those dosage calc in nursing school. And usually the math is very simple when you're actually in the field that you can do it. The student gave the patient a 4 milligram tablet of dexamethasone as dispensed, but 2 milligrams had been prescribed. So what the student needed to do was cut that pill or cut that tab in half. And then another student administered the full amount of a dilantin suspension dispensed in a bottle intended to be used for several doses. So again, be very careful. What is the dose? How many doses are in that bottle? Pharmacies should dispense medications in ready-to-use patient-specific doses whenever possible. Otherwise, provide further instructions on the MAR and the dose itself if possible. On MARs, list the patient-specific dose first before the available dosage strength dispensed, if applicable, as in the following example. Low pressure 25 milligrams, followed by 25 milligrams equals half of a 50 milligram tab. Not sure if things have changed, but they on the MAR when I used to work, it would not say you need to give half a tab. You just would need to pay attention and look on the MAR and know that you needed to give half a tab. Sometimes medication will come in liquid syringes or in oral syringes. Very, very careful. This one is very bad. Preparation of oral or parenteral solutions has led to students accidentally administering these products by the IV route. For whatever reason, maybe the patient can't take tabs or the solution only comes in a liquid, so it will come in the syringe, but you're still giving it orally. Anyways, in this situation, a student gave the patient an oral liquid dose of vancomycin by the IV route. Oh my God, like that's bad. That's bad. A student prepared an oral liquid narcotic in a parenteral syringe while the instructor's back was to the patient. This parenteral means outside of the intestine. The student began to administer the drug via an IV saline lock. A student gave a patient an oral liquid dose of furosemide IV, which was intended for gastric tube administration, so like through their PEG tube. Again, guys, be very careful. Ask questions if you're not sure. Don't just assume, okay? Pharmacists should dispense all oral liquid products in oral syringes. Medication areas should be stocked with oral syringes. Students should be advised that oral syringes must be used when preparing oral solutions and appraised of the dangers of not doing so. Discontinue IV routes as soon as possible if appropriate. And read. If a syringe looks different, ask questions like, why does this syringe look orange? A lot of times they'll be like a brown color, the oral syringes. So ask questions. Preparing drugs for multiple patients. Student nurses have given medications to the wrong patient, particularly when they prepared more than one patient's medications at a time and brought medications for 2 or more patients into a room. When you're a student nurse, you are not, usually until you're in your practicum semester, you're not being given the full patient load. There is no reason. You are a newbie, you are just learning. There is no reason why you should be carrying around 2 patients' medications, okay? A student gave the patient in bed A his medications along with a dose of warfarin, 5 milligrams, intended for the patient in bed B. Another situation that happened is an instructor put medications intended for the patient in bed B on a table while observing a student administer medications to the patient in bed A. The student picked up the wrong medications and gave them to the patient. Teach students by example to prepare one patient's medications at a time and administer those medications before preparing another patient's medication. Stress the risks associated with handling more than one patient's medications at a time, and teach students the organization's process to identify patients using 2 unique identifiers before drug administration. Usually it is name and date of birth. What is your name? What is your date of birth? What is your name? What is your date of birth? Thank you so much for watching. I hope that now that you have learned about these medical errors, that you will learn from these. Make sure that you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. It helps me tremendously and it means the world to me. Thank you.